1. Which principle of adult learning best supports a general X-ray machine operator's ability to retain safety protocols? A. Memorization through repetition. B. Learning through self-directed practice. C. Dependence on instructor-only guidance. D. Observational imitation without feedback. 2. During evaluation of competency in X-ray positioning, which method ensures the most valid assessment? A. Multiple-choice written test only. B. Peer feedback on technical performance. C. Objective structured clinical examination, OSCE. D. Oral questioning by a supervisor. 3. In curriculum development for X-ray machine operator training, which component ensures alignment with regulatory standards? A. Learner motivation. B. Competency-based objectives. C. Instructor preference. D. Technological trends. 4. When communicating complex radiographic safety protocols to adult learners, the most effective strategy is A. Use of simplified analogies and case-based examples. E. Providing only technical terminology. C. Relying on written manuals alone. D. Avoiding real-world scenarios to reduce confusion. 5. Which regulatory requirement must be emphasized in every general X-ray machine operator program? A. Patient billing procedures. B. Documentation of radiation exposure and ALARA principles. C. Advanced MRI techniques. D. Hospital marketing guidelines. 6. A mentoring strategy most effective for new X-ray operators is assigning them independent work immediately. B. Shadowing followed by guided practice. C. Relying solely on textbook review. D. Providing minimal supervision to promote independence. 7. When evaluating a learner's understanding of X-ray beam collimation, the best method is A. Asking for definitions. B. Demonstrating on a phantom and critiquing technique. C. Providing a written essay test. D. Using a crossword puzzle review. 8. Which of the following communication techniques is most effective when correcting an operator's repeated positioning error? A. Public criticism to emphasize seriousness. B. Clear, specific, and private feedback with demonstration. C. Ignoring the error until later evaluation. D. Delivering vague suggestions. 9. An important factor in developing a test blueprint for X-ray operator exams is A. Instructor teaching style. B. Content validity based on practice standards. C. Student preferences. D. Administrative workload. 10. Which principle of adult learning supports incorporating real patient case studies into X-ray training? Adults prefer learning abstract theories. B. Adults learn best when content is contextually relevant. C. Adults rely on rote memorization. D. Adults avoid experiential learning. 11. When designing an evaluation rubric for radiographic positioning, which element ensures fairness? A. Criteria aligned with clearly defined competencies. B. Subjective instructor interpretation. C. Peer voting on performance. D. Random scoring adjustments. 12. Federal regulations require that X-ray operators minimize radiation exposure to patients primarily through A. Limiting patient consent forms. B. Collimation, shielding, and time reduction. C. Using high kVp regardless of diagnostic need. E. Eliminating image repeats at all costs. 13. When mentoring a learner struggling with radiation safety principles, which method is most effective? A. Repetition of lecture slides. B. Guided practice with reflective questioning. C. Ignoring errors until the final assessment. D. Assigning them more reading material only. 14. Which of the following best illustrates formative assessment in X-ray operator training? A. Mid-program feedback on positioning accuracy. B. National Board Certification Exam. C. Hospital Hiring Exam. D. End-of-program written test. 15. A curriculum developed for X-ray machine operator training must include which mandatory subject? A. Nuclear medicine protocols. E. Radiation biology and protection. C. Veterinary imaging practices. D. Diagnostic ultrasound principles. 16. When delivering feedback on improper X-ray exposure settings, the best communication approach is A. Provide corrective feedback immediately with rationale. B. Delay feedback until the next evaluation session. C. Offer feedback only in writing. D. Withhold feedback to avoid discouragement. 17. The ALARA principle in radiography is most closely associated with A. Maximizing radiation to improve image clarity. Keeping exposure as low as reasonably achievable. C. Eliminating shielding for efficiency. D. Increasing exposure to reduce motion artifacts. 18. In designing test questions for X-ray machine operator exams, which approach enhances reliability? A. Using ambiguous questions to test reasoning. B. Standardized and clearly worded items. C. Randomly generated case studies without structure. D. Reliance on a single evaluator's interpretation. 19. Which mentoring approach develops higher-order thinking in X-ray trainees? A. Encouraging reflective practice after case reviews. B. Providing only correct answers. C. Limiting questioning to factual recall. D. Assigning repetitive technical drills only. 20. A critical communication technique in patient-centered radiography is A. Explaining procedures in patient-friendly terms. B. Using only technical jargon for accuracy. C. Avoiding all patient questions to maintain efficiency. D. Delegating all patient communication to nurses. 21. During evaluation, which performance indicator demonstrates competency in patient safety? A. Proper collimation and shielding use. B. Ability to memorize anatomy charts. C. Accurate billing code documentation. D. Ability to recall radiation equations. 22. Which adult learning principle explains why X-ray trainees benefit from immediate clinical practice after theory? Experiential learning preference. B. Memorization first approach. C. Passive listening strategy. D. Abstract conceptualization. 23. In competency assessment, which type of test most closely simulates real-world X-ray operator tasks? A performance-based practical exam. B. Multiple-choice recall test. C. Written essay on physics. D. Crossword review of terminology. 24. Which aspect of regulatory compliance is most important when documenting fluoroscopy exposure? A. Recording exposure time and dose. B. Patient satisfaction surveys. C. Hospital revenue tracking. D. Insurance claim coding. 25. A mentoring model that emphasizes gradual independence of X-ray trainees is A. Scaffolding. B. Autocratic instruction. C. Passive observation. D. Minimal engagement. 26. When providing curriculum updates, which factor is most critical? A. Advances in imaging safety standards. B. Instructor convenience. C. Student popularity of topics. D. Institutional politics. 27. Which type of evaluation best measures long-term retention of X-ray safety principles? A. Immediate post-lecture quiz. B. Delayed follow-up practical exam. C. One-time oral questioning. D. Peer group discussion. 28. To comply with federal radiation standards, all X-ray operator training must emphasize A. Dose monitoring and documentation. B. Patient billing and scheduling. C. Image interpretation by radiologists. D. Marketing of radiology services. 29. When assessing learners, an effective evaluation tool balances A. Reliability and validity. E. Randomness and unpredictability. C. Instructor bias and preference. D. Peer approval and popularity. 30. Which communication skill is critical for ensuring patient cooperation during imaging? A. Active listening and clear instructions. Avoiding eye contact to maintain authority. C. Speaking rapidly to minimize time. D. Using complex jargon to show expertise. 31. In adult learning for X-ray operators, which method fosters critical thinking? A. Problem-based learning with real cases. B. Memorizing radiation physics formulas only. C. Copying instructor notes verbatim. D. Watching silent demonstrations. 32. A general X-ray machine operator program must ensure compliance with A. State licensure and radiation safety regulations. B. National nuclear energy policies. C. Hospital marketing guidelines. D. Federal tax regulations. 33. Which mentoring practice ensures continuous improvement in X-ray operator training? A. Ongoing feedback with goal setting. E. Limiting feedback to annual reviews. C. Avoiding direct observation to build trust. D. Only correcting errors in written exams.